You're watching the AM show. February 4, 2017 was World Cancer Day over the weekend, and we thought, let's help ourselves and have some education on cancer. My guest today is Dr. Joel Yanni. He's head of the Radiotherapy and Nuclear Medicine Department of the Korle Bu Teaching Hospital. That's a big department. And we have the head of that department here. It's a pleasure. Good morning to you, sir.
Good morning.
Yeah. Can you first of all explain radiotherapy and nuclear medicine? What's that?
Radiotherapy is the use of ionizing radiation to treat cancer.
Okay.
Right? And nuclear medicine also uses radiation, but in different forms, usually for medical investigations and sometimes for therapy, imaging in particular.
Okay. I'm not sure.
It's not too clear.
But that's fine. It's a very special area. So we're talking cancer. First of all, can you help us, for those of us in Ghana, is there like a common cancer that we're prone to because we're Ghanaians?
Okay. Not because we are Ghanaians, but in general, in Africa, there are some common cancers in males and females. Not too different from the rest of the world anyway. Amongst females is cervical cancer and breast cancer. For most parts of Africa, it's breast that is number one, followed by cervical cancer. But in Ghana, cervical cancer that is number one, followed by breast cancer amongst women. Okay? And that is a bit different from the developed world, because cervical cancer is basically an infectious disease. Okay, even though it's a cancer, the etiology, the cause of it is from an infection. Just that the interval between the infection and when you develop the disease is quite long, maybe about 15 to 20 years. So initially it was difficult to target to the infection as a cause, but it's now clear that it's an infection. In the developed world, they found ways of picking it up at a very early stage. Okay, so it doesn't develop into cancer. So you hardly see cervical cancer in the developed world. Okay? Amongst men, it's mainly prostate cancer. We also have liver cancer as well. Okay. These are the common cancers in Ghana.
But if it's if cervical cancer is from an infection, then why can't we treat it? Why do we wait for it to develop?
Yes, so you can treat the infection, but it's a viral infection.
Okay.
And viruses are not easy to treat, and the way it is, at the time that you develop the infection, you may not even know. It's silent. Sexually transmitted by a virus, human papilloma virus. Okay. There have been several approaches to management. One of the ways is picking it up early and taking care of it. Okay. The other way is to recently. There's a vaccine, okay, because it's sexually transmitted. When you get vaccinated and you develop immunity against it, then even when you engaged in activities that's sexually transmitted, because you are immune, you don't develop it. So you can vaccinate girls and then boys as well. Just before they become sexually active.
Okay. So this is by what age? You're talking about
between
teenagers?
9 and 14, yeah.
Okay.
Yeah.
Okay. But is this really known? This is the first time I'm hearing that you can take a vaccination.
It's known.
To stay immune.
It's known. In the developed world, it's part of the immunization program. We understand the issues. Policy has determined that it's supposed to be done. It's available in the country, but it hasn't been rolled up countrywide.
Maybe it's because we don't expect young girls and boys at the age of 9
Not
to be
really.
having
It's
sex.
just it's money.
Okay. So the vaccine is not available to us then?
It's available in private.
Oh, okay. So when you take it, for how long are you covered?
Oh, like all immunizations, there may be a boost, but you are covered for a very long time.
Is it different from the pap smear?
Yes. So pap smear is another way of picking it up early, picking the disease up early. You know, treatment of cancer involves several procedures, but the earlier you pick it up, the greater the chances of doing something about it. And then the therapy as well is more effective when it's early, and it's not too difficult to go through, right? Very simple measures and can cure it. So you do a pap smear, you take cells from the cervix and examine it under a microscope. Okay, when there are changes there that point to cancer, there are specific things that you should do. Versus when it develops into a mass that is palpable, that you can feel it and is visible, that is frank cancer. Okay, that will be diagnosed with a biopsy. You take a tissue, but perhaps you just take cells from the cervix. Okay. You see, cancer is a non-communicable disease versus communicable disease. Like, if I say communicable disease, I mean you can contract infection, can pass, one person can pass it on to another person. Non-communicable diseases, not infectious, so you cannot pass it from one person to the other. And it's usually no cause. You may not know that you have the disease at the time that it manifests. It may already be too late. Okay, so there are the common ones: hypertension, diabetes, and cancer is also one. Diabetes and hypertension, for instance, may be asymptomatic. You may not have any symptoms at the start. Okay, it's later on in the evolution of the disease that you develop symptoms. So that makes that group a bit dangerous. Okay.
Okay. So let me take you back to the vaccine. Is it too late for somebody like me to take a vaccine? And I'm talking about the cervical cancer.
Yes and no. So it can be tested. If you test you and you are not immune, you can be vaccinated.
But can I be immune even when I haven't taken anything?
Yes, it may be that you've been lucky or you are a nun, so you've not been sexually active. Then in that case, it means you have not been.
Okay, I get you.
It means you haven't been exposed. Yeah.
Okay, but you know that I have been exposed, so.
Oh, how will I know?
Okay. All right. How do I move on from here? So I need to be tested first of all to see if I'm immune or not.
You see, people, women who are past that age, I think the more practical thing is to do pap smear.
Okay.
Yes. And then another one we call it visual inspection. We paint the cervix with a solution, and then you just have a look. If there are changes there pointing to cancer, there's a change in color, which you can see. So individuals who are past that age, I think it's
a
better approach
of a vaccine.
You don't look like a 9-year-old, do you?
No, I don't.
Yeah, but I'm talking science.
Yeah.
You know, I just wanted to explain that before you become sexually active. Yes.
Okay, so the vaccine is most appropriate before you become sexually active.
Correct.
Okay. Correct. My point, where I was coming to really, is that if cervical cancer is one of the killers, one of the main killers for women and girls in Ghana, why then don't we make the vaccination mandatory? Why is it not free? Why is it not everywhere?
Yeah, but can we afford it? These things are expensive. I'm sure over time it will be available. Like, you see, there's a history to it. For instance, hepatitis B, right? Hepatitis B infection can transform into cancer. Not all cases of hepatitis B develop cancer. Yeah, but quite a big chunk will develop cancer. It didn't used to be part of our immunization, but now it is. You see, so we expect that after about 15 to 20 years, from now, the incidence of cancers of the liver will go down because it has been included in our immunization panel, and we expect the same thing for cervical cancer, but I think it is more urgent. Yes.
Okay. You know, the way breast cancer awareness is, I mean, I think it's a whole week dedicated to breast cancer awareness. It's massive. I'm not sure we have the same for cervical cancer. Do we know as women, and forgive me because I'm coming to women and girls a lot more with this particular conversation.
You see,
are we aware of this disease?
I think that some 5 years ago there was a lot of public education about it, but I have a take on this. You see, I really don't like our approach where when it comes to celebration, we are marking, let's say, breast cancer day or cancer in general, because the UN has suggested that maybe
4th February is.
Okay. Then there will be a lot of publicity, but it's ad hoc. You see, it's ad hoc. So after marking that day, for the rest of the year, we are quiet. We should develop a systemic approach, right? We have our health system very well organized, to the extent that when we follow the organizational structure and implement immunization policy, countrywide coverage is almost 100% for immunization. Why don't we do the same for cancer? Okay, so that the implementation can be at the CHIPS compound, health posts. The district health management teams will manage cancer. You see, so that it's part of their programs. You see, so maybe they'll have a program. Let's say every month they go into the community, or maybe they even include it into what we call the child welfare clinics. It reminds me of my kid sister. I remember when we were growing up, very young, you say, "Oh, I'll speak vernacular."
Yeah.
She wanted to say, "I'll go to Wayne." You see, if it's implemented at that level, then we'll have programs. There'll be consistency. It will not be the case that October, then we say, "Oh, Pink October," then we make a lot of noise about it and forget about it. Again, there's a district health management team all over the country. Okay, if you go to the remotest place in Ghana, there's health coverage of some sort. So if you do it that way, then the penetration becomes very high, because those in the cities, urban areas may have heard about breast cancer and cervical cancer. So, but what about those in the villages? See, so that is the approach that we have. We've developed policy in that regard, but the implementation of that policy has been very slow. All that I'm talking to you about, we have a national cancer control strategy. Yes.
We have a national cancer control strategy.
Yes, as a country, but it's the implementation that has been a bit slow.
I want to find out what the biggest challenge in fighting cancer in Ghana, what it has been. Is it money? Is it cultural, for instance?
Both. Yeah, money has got a part to play, but I will also say that our paradigm to disease causation also affects us, right? We resort to all kinds. We call it, as a group, we call them complementary and alternative medicine. So, what do you think is the cause of the cancer? If you think that is witchcraft, you will resort to remedies that will deal with the witchcraft. Okay, and I will not say that herbal medicine is ineffective, but you see, there are standard ways of treating diseases. You can resort to herbal medicine, all right, but make sure that you go to hospital and doctors deal with it. After that, if you want to resort to herbs and so on, you can. But to stay at home and just use herbal preparations, don't go to hospital, then you come in at a very late stage. The thing with cancer is that it starts at a point in the body. Let's say it starts in the breast. or cervix or wherever, it spreads to the rest of the body. Once it spreads to the rest of the body, it becomes incurable. So when you present at a stage where it's gotten to other organs, okay, it's moved from the primary source to other organs, then it becomes incurable. Whatever we do as health practitioners is palliative. We're just trying to alleviate
your pain,
or let's say some symptom, bleeding, whatever. But we know that the disease will eventually.
But do we have the expertise?
Definitely, it's expertise. In fact, we are blessed as a country, probably because we had a very good medical school from the beginning. I think human resource wise, in terms of numbers, maybe inadequate, but expertise is available. We have people coming from the sub-region for medical tourism in Ghana. And a lot of times we even have Ghanaians who travel from here to places such as India, sometimes US and so on. The reports, medical reports we give them states the kind of treatment that we are doing. Sometimes they go there and come back.
It's the same.
Yes, it's the same. It's the same. So expertise is available. But late presentation, there are a number of factors. For instance, breast, for instance, there's fear of mastectomy. One of the ways of treating breast cancer is to remove the breast. Okay, like Jesus said that your arm is worrying you. What do? You exercise it. Yes. Okay, you exercise it. But in the treatment of cancer, that is not the whole truth. For instance, you may take off the breast, all right, we've seen several cases. Then it comes back along the chest wall. Okay. Or maybe at the time that the breast was taken off, some of the cells may have escaped already.
Okay.
Right? The cells are very minute, you can't see them. Loitering around in the blood. And they lodge, they find a sanctuary, they lodge there, let's say in the liver. So even though you've taken off the breast, over time, the cells that have lodged in the liver will grow. So then we say you've got metastasis. It's gone to the liver. Okay. So understanding the biology of cancer, our approach is three-pronged. There's local treatment of the local disease, where it started from, okay, and that involves use of surgery and then radiotherapy.
Okay.
Then, because the cells can travel elsewhere, you need systemic therapy, treatment that will cover the whole body. Okay, so we may give IV. Okay, some of these, and this is standard by the way, all over the world. Some of these therapies may have some side effects that are unpleasant. By the way, no side effect is pleasant, but some of the side effects may really be
such as
pleasant. For instance, chemotherapy, you may lose hair, vomiting, diarrhea, and so on. But these are called acute side effects. It occurs in the period in which you are giving the treatment. It will just pass away, and you recover.
Okay.
And by our training, we take care of people when they are in the acute phase. Okay. Unfortunately, some practitioners take advantage of it, and because there's no regulation in this country, people come on air and say all kinds of things. Hey, when you go to this place, they'll burn you, you do this, you do this, you come to me, I'll pray for you, no side effects, you'll be healed. We all believe in the saving power. We all believe in the saving power of Jesus Christ. We are all Christians, yes. But even when Paul had a tummy ache, he was told to resort to some medicine. It's in the Bible. So you combine the two, you have to be wise. You have to be wise. And if you believe in prayers, it doesn't mean that you shouldn't resort to medical treatment. You can do both. Prayers, for instance, doesn't conflict with the treatment that we may give. But herbal preparations may conflict with. at the time that you are taking chemotherapy or you are taking radiotherapy or even surgery, there are some herbal preparations that inhibit healing. So let's say there's a cut, and from the surgery, it will take, let's say, a week to heal, right? Use of the herbal preparations will extend the healing period to, let's say, 2 or 3 weeks. This is not something that we desire. Or you take herbal preparations. By the mechanism of action, the herbal preparations, some of them may interfere with the way the medicine works, and therefore it becomes ineffective. Okay. So whilst on the conventional treatment, we advise that you don't do herbal preparations. Okay. You see, again, as a profession too, sometimes I know we carried out a study in Kolebu, and we found out that 70% of the cancer patients that visit us will not tell their doctor that they are using other preparations for fear of the way the doctor may react.
Okay.
So we have to create a congenial atmosphere for patients to be able to interact with us, and whether we like it or not, people use it. So then financing too is a problem. So we are talking about why people present late. Yes. So fear of mastectomy, and sometimes even the hierarchy of decision making in the home can even cause delay. You have to wait, but maybe probably related to funding. You have to tell your uncle. People have to agree for you to go to hospital and so on. And then if you don't have money, you resort to.
But if you don't have money, it's like a life sentence, right? So a scenario is created. Your mother is a petty trader, your father is a farmer, and there you are, you have cancer. That's it.
Are you saying farmers are poor?
Well, I'm just...
I've caught you there. Yeah, I understand what you mean. You see, Ghana, because of the way we organize our society, if only you are prepared to go to hospital, most people will have a relative, extended family system. Most people will have someone
to support.
Yes, to support. You see, and if you visit the hospital and you have problems with payment, usually we will find ways of taking care.
Really?
Yes. Yeah, usually we would.
So ways such as, I mean, if I came and I have cancer. Yes. And I told you that I didn't have any support, I couldn't go to anybody to get the money, what would you do as a hospital, as a department?
Well, there is a social welfare. We'll refer it to the social welfare department. If it is proven that indeed you are a pauper, then you'll be taken care of.
We've had people come to us as a media house to help raise funds for them.
Yes.
If the hospitals could facilitate, could support, they wouldn't be out. To present their situation and ask people
we are all in the system. We are all in the same soup. We are also fulfilling your obligations. So we recognize you as being partners.
How expensive is it to treat cancer?
Cancer is not one disease, you see. So it is very difficult to say that it costs this amount to treat. Right? It varies. It depends on what you do. Sometimes we combine radiotherapy, surgery, combine chemotherapy and surgery. So it depends on the combination. So I wouldn't be able to give you a fixed amount.
Okay.
This is how much it's costing.
You mentioned prostate as the #1 cancer killer in men in Ghana. Do we know what is causing this?
Prostate, most of it is sporadic. By that I mean that it can happen to anybody, right?
Not because you've done something wrong.
No. I won't. I am not a pastor. I will not tell you that. Okay, you have committed this crime. That is why you are developing cancer.
It may also not be genetic. You may just.
That's why I'm saying that about 5 to 8% of it may be genetic. Okay. So if you have family history, we should be aware of it, and then doing the test, the PSA. At the time, there's an age group from 50 onwards. But if you know the age at which your close relative developed it, that can guide you to know when to do those tests. Okay, but like breast cancer, most of it is sporadic. It just happens. Okay, it's not because you've done. Yeah, there are causes of cancer, general causes of cancer, like let's say smoking, alcohol intake, certain medications, radiation, and so on. But these are all general. For an individual, a lot of times it's very difficult to determine that this is what the person did and therefore developed cancer, except for, let's say, cervical cancer that we know that those that are related to infections. Yes.
Is there a general rise in the cancer cases in Ghana?
It's difficult to determine, but because we don't have a national population-based cancer registry. If you say a registry, you mean a department that, let me be literally counts the number of cases. But we know the number of cases. How many people die at home?
But how many people die in the hospital?
You see, so the people who die in the hospital is just a tip of the iceberg. We are in Ghana, okay? How many people are buried in the village without death certificate? Medical cause of death. You understand what I mean? Even those who die in the hospital, there are cases where the medical certificate is not well filled. Because the way cancer, let's say cervical cancer, causes bleeding, and eventually, let's say, causes renal failure. So if it is registered as renal failure, then you lose sight of the fact that cancer is the primary cause. See? So it's now that we are developing a cancer registry.
Okay.
Yes.
So even for you at Korle Bu, is there...
Yes, but I will say that going by WHO figures and extrapolations from neighboring countries, the general picture is that there's a rise in the incidence of cancer. And the projection is that most of the increase in the incidence of cancer across the world will come from developing countries like Ghana. That is what the WHO has predicted. So going by that, I would say that the incidence of cancer is increasing.
Okay.
But specifically to Ghana, it will apply, but we need our own figures.
Okay.
We are working at it.
What kind of cases do you see, for instance, at Korle Bu?
Yeah, so the cases that have
the cervical, the breast cancer, the prostate,
and then the head and neck cancer.
There's a head and neck cancer.
Yeah.
How does that come about?
Head and neck cancer.
Yes.
Okay. So one of the head and neck cancers is cancer of the voice box.
Oh, okay.
Larynx. So you witness a change in the caliber of the voice, and it's cancer involving the back of the nose. We call it nasopharyngeal cancer. You have bleeding from the nose. You may develop neck swelling. And there is cancer of the you see this area, we call it the maxillary sinus. Can develop cancers there. There are many.
When you're diagnosed of the disease, any of its, is it like a death sentence? Is that the end of you?
You see, in general, we say 1/3 of cancers are preventable, and another third are curable, and another third incurable. Okay, so for that 33 1/3%, you cannot, whatever you do, patients will succumb to it. It depends on the biology of the cancer. Even for, let's say, one site, breast cancer, it's not a homogeneous disease. The biology varies from tumor to tumor.
Okay.
So if 1/3 are preventable, another third can be treated and cured. It means getting to 70% of cancers can be cured. I tell you that I have patients, there are many patients we treated over 10 years ago. They are around.
As in survived it.
They survived it.
Cancer never returns.
Yes, it's over, in fact, some 15 years. Right? there's a child that I treated around, I think, 12 years or so. He's finished university. There are several of them, but you see, there's still stigma associated with disease. So if you ask them to say something about cancer,
share their story,
yes,
tell
yes, a lot of them don't want to. But because it's like it's a death sentence. It's like telling the whole world that I'm dying tomorrow. That is how it is perceived.
But if you've been cured, then that's not how it is then, because physically there won't be anything on you that would say that you had cancer in the past.
But, yeah, but you're also a Ghanaian. There'll be rumors around, you'll be talking behind you. You know that guy. You see, versus elsewhere, that wives of presidents like Barbara Bush and others who come out and say that, oh, I developed cancer, this is what I did, and around. Even when they succumb to disease, everybody knows that this is what happened. But for us, we hide it.
I don't know about Ghana specific, but I know that elsewhere there are serious research. I don't know if there's any latest and if Ghana is involved in any way.
Oh, we are involved. There are research institutions in Ghana involved in local studies as well as participating in international studies. Noguchi, even Kolebu, CSI. We participate in international.
So what's the latest breakthrough then?
For cancer?
Yes.
Nothing magical. But we are moving towards the era of, we call it molecular biology. We are studying the relationship between genes, okay, and the chemical pathways at that level that cause cancer, and therefore are able to deal with it using newer approaches, novel approaches.
Okay. Is this peculiar to Ghana?
No, this is general.
Okay.
In the world, and we've had some successes, even though those drugs are usually very expensive. But over time, they become affordable.
Okay. My last question to you, because we have to wrap up. How can you support somebody who's diagnosed of this disease, any of the cancers?
Okay. So if the patient has a bill, okay, if the patient has a bill,
as in finances.
Yeah. So then it's directed at that institution. Otherwise, there's a Cancer Society of Ghana. Okay, so you can help through the Cancer Society. So you see that through the specific department, specific hospital.
But as an individual, if my family member has the disease, what do I do? Do I just help the person to die in terms of, oh, sit down and reflect on your life because eventually you're going to die?
No, I've already made mention of the fact that 70% of cancers can be dealt with. So it's not a death sentence. Okay? Yeah. So you should seek appropriate help, seek appropriate treatment.
Okay.
Yes.
So fight it.
Yes.
Continue to fight it.
And there are survivors. In fact, the department has been in existence for getting to 20 years. So this year we intend to mark a 20-year anniversary, and we've started making arrangements for formation of a survivors group.
Okay.
Yeah, we'll outdoor it at the time.
Okay.
Yeah. So that Ghanaians will know that there are several people who have survived cancer walking around.
Sure.
They don't tell you will not know.
Okay, Doc. I've enjoyed this. I think you're a fun person to hang out with, even when you're talking about a disease like cancer. Thank you so much, sir, for your time, for being here on the show. Dr. Joel Yanni, he's head of the Radiotherapy and Nuclear Medicine Department of the Korle Bu Teaching Hospital. We're grateful that you could make it. It's your birthday today. I want to wish you a happy birthday. CEO of Syndicated Capital, Mr. Kofi Appiagyei, from the Multi-TV Distribution Department to you. It's a happy birthday to you. Happy birthday to CEO of Syndicated Capital, Mr. Kofi Appiagyei. Enjoy your birthday. Stay with us just before we wrap up. We have some entertainment coming your way. Stay right there.